Welcome everyone to another episode of Hard Work Beats Talent, where we aim to draw upon the insights of our inner circle in order to help our listeners make more informed decisions about their career and life journey. I'm Alex, and as always, I'm joined by my good friend and co-host Nikita.
What's good?
And before we get into it today, guys, please can we ask that you subscribe, follow, like and comment. That's the Hard Work Beats Talent podcast on all major platforms. We've really appreciated all the feedback we've received so far, and we just ask that you continue so that we can make the small tinkers to this to make it better and deliver more value to you as our listeners. But with that said, on today's episode, we are very excited to be joined by a good friend and member of our inner circle, the man, the myth, the legend that is AJ. How's it going, AJ?
I'm good. Thanks for having me.
What an intro.
That. Yeah, what an intro.
Buzzing to have you today.
Sarah's in trouble. I'm going to go home and say
So to kick off, AJ, can you just give us a really brief elevator pitch as to who you are, what you do, and kind of all that good stuff?
Yeah, so things that you want to know. Yeah, so I'm AJ. So I'm a doctor training to be a GP at the moment. So I'm in my second year of training. Special interest is sports medicine. So I do some sort of work with academy football at the moment. Also interested in education, so I do some teaching with medical students, and then I sort of do like ad hoc, what we call locum work in A&E and stuff. So variety in the week is what I'm looking for, and so just trying to build towards that, I suppose.
Never a dull moment by the sounds of it.
Never.
He's a busy man. So I guess diving straight into it, it's all kind of medicine focused.
Yeah.
So is your day-to-day job being a doctor?
Yeah.
Do you specialize in any particular area? What kind of medicine do you practice?
So my specialty is general practice. So anything and everything.
Okay.
Anything can come through the door.
Yeah.
Even, most of the time you actually don't even know what's going to happen until the patient actually walks out of the room.
Yeah.
You know.
So just knowing that, what does your day-to-day look like? It sounds like it's going to be very varied.
Yeah.
Being a general practitioner, you see it all.
Yeah.
You feel it all. You know what I mean?
Yeah.
I do really hold GPs in really high regard because they do such a fantastic job under really intense, stressful circumstances. So do you want to give us a little breakdown on day-to-day, what it looks like, how your day runs?
Okay, so my alarm goes off, I get out of bed, no, I'm joking. Right, okay, so when you get to work, I suppose it depends on what time you get, and I like to try and get about an hour early because there's more admin than you've got time to do. I think that's one of the really interesting things about GP that maybe a lot of people don't know, is that one patient generates a lot of admin. You have to write the notes, and sometimes you have to refer to hospital, you have to write referral letters. If you have sent off a blood test, you have to check all of those. Any scans that you've requested, you need to check what the reports to that are, and you have to action all of those. So generally, I like to go in the morning and have a look at what patient, who I'm going to see if I know. Have a look at some of the blood tests I've requested, if there's anything that I need to do. So just get that first admin bit out of the day. And that's not the admin that's generated in the day that you're about to start. That's all been from, whenever. So I start with that. Everyone knows that it's like the Hunger Games to get a GP appointment.
Yeah, it literally is.
Right.
It literally is.
And another very interesting thing is when you go in at 8 a.m., you look at the appointment screen and there are no appointments on the screen. So no one's actually booked in for the day, apart from if we've had to book in routine appointments 3 weeks ago. So I don't know. I think on any given day, there's probably about 8 or 9 GPs.
So your practice is one of those where you call up at 9 a.m.
8 a.m.
8 a.m.
Yeah, 7:55 to be exact.
That's a hack. 7:55, guys.
Yeah.
So to get an appointment, you have to call. My GP is still quite old school. You can book an appointment for 3-4 weeks time.
You can.
Because that's the next available appointment. But
yeah.
You kind of have to book in advance unless it's an emergency.
Yeah.
Or you can get in to see one of the locums on a Saturday.
On a Saturday or something, yeah. That's a really good point, actually. So sort of just distill it down a little bit further. There are emergency appointments or on-the-day appointments, and then there are routine appointments. You can't call in the morning and book a routine appointment for the day. You can only call in the morning and book an emergency or on-the-day appointment.
Okay.
If you and you can call it any other time to book an appointment for a week, for 2 weeks, for 3 weeks. But if you want to see a doctor on the day that you wake up, you have to sort of try and, get through the crowd, which it can be very difficult.
Yeah.
So bringing it back to your day-to-day, get in, do your admin, so an hour early, screens are blank. So does that mean that patients are coming in on a rolling basis then?
So it means that when I look at the screen at 7:55, I don't know who I'm going to see. When I look at 8:01, my whole screen is full.
Yeah.
Right. So that I can see, and generally, people will tell receptionists what they're coming in for. Whether or not it actually matches what they say to you, that's a whole different story.
Is this quite a new thing? Where the receptionist asks you the reason for seeing? Is it like a triage process, or what's the crack?
I mean, I think it's just
younger and
you don't know.
Yeah.
I mean, I've always thought it was that way. I think it's just to give the doctor a little bit of a warning. I mean, you can always say no, and a lot of people do say no, and I think that's fair.
See, I never knew that was an option because I've just been bearing my soul.
Tell him everything.
And I was like, this is a bit uncomfortable. I don't want to tell you my problem. There's no patient-doctor confidentiality here.
Yeah, you don't have to. I think it helps. But you don't have to.
The receptionist is like, really?
Yeah. God damn. Fair enough.
That's funny. And then you just start seeing your patients, and then you just, back to back, and maybe get a break in the middle of the day and then start again. So essentially we run our days as we call them sessions. So the morning is one session, the afternoon is a different session. So you do 2 sessions in one day and then just go like that.
And by the sounds of it, because obviously we'll get onto it, the medical degree I'm sure is quite holistic, but it sounds like you're dealing with people from all walks of life. Like, did anything prepare you for that, or like is that something that's been quite surprising in terms of how you might have to adjust your approach according to the different patient/scenario? Like, it'd be actually quite interesting to hear about that. Obviously, no names included, of course.
That's an excellent question. I thought about that, and I think about that a lot as to how do you relate with the breadth and the variety of people that you see. I think one thing is experience in the job. So we rotate around hospitals, and I think that, hospitals, all areas are different, right? So, I've worked at Chelsea and Westminster, I've worked at Northwick Park, I've worked at Whittington Hospital, all very different areas in terms of patient demographic. So you come across different problems, and I think
this is a part of your training?
This is a part of my training, yeah. Okay. So this is when I've been a doctor. But before that, I went to medical school in Kiel, which is in sort of the Midlands, so Stoke-on-Trent. Yeah. And obviously I went to uni in Southampton. So I've been around lots of different places, and I think everywhere that you go, you pick up things about people, sometimes consciously, other times subconsciously. And I think that helps you relate, or at least helps you try and understand where people are coming from and how to deal with sort of different types of people.
And sort of on that subject, I guess, what are your... I would imagine there are trends, right? Like, I'm just being like purely just, off the cuff here. I'm not intending to offend anyone, but like, do you get like more of the elderly type of people that, have more routine issues coming in, and you see, Doris on like a weekly basis, or do you really get like a really broad range of problems and, age groups and things like that?
It's a broad problem. I mean, sometimes you might see the same person a couple of times, especially if you want to follow them up. But generally speaking, you see lots of different people. I mean, some GP practices have about 18,000, 19,000 registered patients. I mean, you won't see all of those 19,000, but you can get a lot of access to a lot of people at any given day, and it's lots of different things. Yeah,
I remember growing up, like when we came to the UK in '93, we signed up to this surgery in the town where we lived, West London. And he was our GP, like he knew me since I was like 5 through to, my late 20s, and then he retired and passed on his practice. But it was just incredible. Like, you walk in and he like remembers your name, your background, how's your mum, how's your dad, all this kind of stuff. But probably now, has that kind of changed a little bit?
Old school family GP.
Yeah.
That's definitely changed, but I think that is sort of a product of society. I think society has changed quite a lot. Now, this is my personal opinion, so I don't know if it carries, but I think that one thing that I think I've noticed is sort of, because life is so fast paced and, you know, it's expensive, especially in parts of London, that community that people used to have is not so easy to find. So I find that some of my sort of older patients, they've always lived in the area, their mum always lived in the area, their grandma always lived in the area. But as people tend to get younger, you find, you know, they've got one relative in the northwest, one relative in the southeast, one relative doesn't live in the country. So I think that family GP thing goes just by extension of...
Particularly in places like London or the big cities,
And also people don't, you know, especially younger people, like, you know, they just want to get what they want to get and get out. We're an instant culture life, so...
Subscription model.
Yeah, exactly.
My other half likes to say. Going to switch it up a bit here, because I obviously went into the legal sector and kind of studied law at university, and one thing that wasn't so apparent to me immediately was the lack of role models that looked like me. Curious to know as to whether or not you've had a similar experience in medicine, or if you've seen like kind of your people who are like your people in the profession, or people that you could reach out to as mentors. Like, is that something that you've also noticed, or is it?
That's a good question. I think one of the things that I have sort of been surprised by in different places that I've been is that I always say that I know that there are black doctors, I just don't always see them. And I don't know if there are lots or if they are concentrated in a specific place or in a, you know, part of London particularly. So that's just by the by. I mean, I don't think there are lots and lots and lots of black doctors. I think there are enough. Role models wise, again, I think an extension of that is that you don't really see that many people that are much older than you or further on in your career. I've actually been quite lucky in that I have met some older black doctors along the way who have, you know, given me good advice, really supportive. You know, I can sort of text at any time. You know, we all happen to be in different specialties, but, you know, it is what it is. And that's why actually one of the things that my friends and I that are black doctors talk about is sort of helping the younger generation, because you don't want it to be that your negative experiences, and I put that in inverted commas, but your negative experiences, you don't do anything about it. You experience it, let it go, and let it happen to someone else. So we do try and like bring, you know, some of the younger students
and awareness as well.
Awareness
and expectation setting.
And the other question that came to mind, slightly different, but I have friends who've gone into medicine, and from what I understood is it's quite competitive to get a permanent role in certain locations. And you went to university in Southampton and studied at Keele. What was the process like for you to, because did you grow up in London?
Yeah. And I went to school outside London. Okay, so process to medicine. So there are actually quite a few different routes that you can get into medicine. I think probably what's easiest if I just outline what the general routes are, and then I can go.
That would be great.
So it makes a little bit more sense. Okay, so so medical school is 5 years or 6 years generally. So 5 years will be leaving school, going straight to medical school, and just doing the 5 years of your degree.
And before you get onto a medical degree,
yes,
is there any courses or not courses, but like you have to do exams to get into university, like an MNAT or something?
It'd be your A levels, wouldn't it?
You probably have to like select certain A levels.
Yes, to be able to do
that. And then is there anything before getting a place?
There was an LNAT test, I think, for certain universities to study law. I don't know if there's something similar for medicine.
For medicine, okay. Right, let me take it all the way back. Okay. So let's start at A level. So you have to do your A levels. I mean, you do science A levels. I think there's always scope to do one different A level. I did English as my other A level. I did biology, chemistry, and English. So you do your A levels, and then there is a test called the UK CAT. So that's sort of like an entry test. And there's another one called the BMAT, and you know, universities pick them for different reasons. And essentially, if you have grades that can get you into medical school, they then use that UK CAT as an extra entry level. Some universities have a straight cutoff. If you don't get that cutoff, you're not going to go to medical school. Others have it as a ranking process to be able to whether they're going to interview you or not interview you.
Right, okay.
So most universities will have that. So you would do your A levels, do that test. Straight through medical school is 5 years. Some universities have something called an intercalation, which is essentially where you use a year to study something in medicine in depth, and that makes your degree 6 years.
What's the purpose of doing that? Is that like doing a master's in law at the end of your law degree?
It depends on who you ask. Some people think it's entirely pointless.
Okay.
I suppose you have to ask each individual university. I think for some universities,
is it practical?
It can be anything. Some people do anatomy, which would be practical. I know at Keele, one of the girls in my year did ethics of medicine or something like that.
Right.
And some universities, that year is compulsory. You have to do it.
Right.
Whereas other universities, that's an optional year. So that's all from sort of undergraduate. You can go to medical school for 4 years if you've done a degree before. And as well as the UK CAT, the BMAT, there is an extra test that some universities ask for if you want to do that graduate medicine entry, which is called the GAMSAT. And that's a very, very difficult exam. I didn't do it.
So is this if you take the route where you've gone off another degree?
Yeah. So if you've done something else before.
Yeah. So we've got, at the moment, 2 potential routes. Your traditional route, where you do your A-levels, you do one of these like UK CAT exams, you get into university, you do your 5 years or 6 if you have an additional year you have to complete. And then you have the second route where you can begin a different degree.
Yes.
Is it somehow associated to science or?
It doesn't have to be.
It could be like English.
It can be English.
Okay.
One of the doctors I work with did law and French and something else, and then did graduate medicine, and then is a doctor now that I work with.
And to do that, you have to sit this exam.
You don't have to, but it depends on what university. So I think, for example, Newcastle University asks for the GAMSAT for graduate medicine, whereas Southampton, for example, well, I don't know what it is now, but when I applied, you could just do UK CAT to do that.
And is that, you have to have completed that undergrad?
You have to have completed
You've completed it, and now you decide you want to be a doctor.
Yes.
You potentially have to sit this exam, and then it's 4 years
after.
4
years, yeah.
Okay.
Yeah.
Okay, that's really interesting.
Or you can also then just apply to the 5-year course, which is what I did, by the way. But yeah, you can.
Oh, right. Okay. Okay.
So.
Was there any benefit to doing that, or that's just a personal preference?
I think for me, it was twofold. I think graduate medicine is super competitive, and there are only about 3 or 4 unis at the time that did graduate medicine. So in order to give myself the highest chance, I applied to 2 graduate medicines and 2 4 years and 2 5 years.
Right. Okay.
Sort of spread yourself.
Yeah.
And it's just 1 year at the end of the day.
Exactly.
And then so once you've done that,
yes,
you've obviously gone down the general practitioner route.
Yes.
There are so many different lanes you can get into, right?
Yeah.
So you've done your, let's just say, 5 or 6 years.
Yeah.
What's next? What do you have to decide? What decisions do you have to make?
Okay.
And like, how do you focus yourself down an area of speciality?
Okay. So when you finish medical school, we have these 2 years called foundation years. So you hear a lot of people talk about F1s and F2s. And depending on who you ask, myself being one of them, sometimes it is very pointless. I think the first foundation year, I'll give you my personal opinions after actually, but so you do your F1 and your F2, and those are essentially what they're called, just foundation years. It's just getting you, particularly the F1 year is getting you used to being a doctor, giving you experience of different specialties.
Do you work in a hospital?
Yeah, you work in a hospital. Yeah, you essentially you start working as a doctor, that you just rotate around.
Okay.
Some people, cynical people would say it's just service provision. But it can be.
Is it unpaid?
No, you get paid. Okay. Yeah, you get paid, yeah.
Just on the degree side of things, because I think it'd be good to bring it to life a bit. I remember when we were at university, we were obviously studying, you did law and business, I studied law, and it's kind of reading and writing, whereas the medics were looking at dead bodies.
Mad.
Are there any kind of things we wouldn't know unless you've gone through it, that people who might be thinking about, say, doing a medical degree perhaps should know, that it surprised you when you actually ended up doing your medical degree?
So on my first day of medical school, 3 of the students fainted into the cadaver.
That would be me.
Yeah, take what you want from that. And do you know, as long as I live, I'll never ever forget my first day of medical school. It was crazy because
was that just when they kind of lift that like little blanket?
No, because
like,
it's not just a lift. It's like, okay. Let me talk you through. Let me talk you through anatomy. Just let me talk you through that. So you go into a room, right, and it's cold as it is freezing in there. Okay, and then you have all these steel silver trays. Have you seen Grey's Anatomy?
Yeah.
Grey's Anatomy is not like medicine in England, but actually this is this probably helps.
Good representation.
Exactly. So you've got all these silver trays, and there's obviously something on them, but they're covered, right? You uncover it, and there's a dead body there. Cadaver is the medical term, and people have kindly donated their bodies to medical school, so you can do that. And the whole point of doing the anatomy, and we used to do it weekly in our first year, was so that we could learn about the organs and have a proper appreciation for where they sit in the body, how they work, and all those sort of things. And it's a bit different to sort of classroom learning, which I really liked, and everybody likes cutting stuff up. So it's more morbid side.
Yeah.
And so you make the incision, you cut down the middle, and then you sort of expose sort of the ribs and whatever. Sorry, it's a bit gory. So depends on what time you listen to it.
Yeah.
Don't listen to the next part whilst you're eating.
Yeah. Potentially explicit content coming up.
There we go. And then, so we're looking, right, what's going to happen next? Because obviously there's ribs in the way. So we're thinking maybe they pre-prepared it or something, which is going to lift the ribs up. And the anatomy demonstrator says, right, guys, we need to crack the ribs open.
Oh, my God.
I whipped my head around like...
What do you mean crack?
Sorry,
what? Rib cutters.
Wow.
Yeah, honestly.
Mooch is on the edge of his seat right now.
Just sitting. Rib cutters. Put underneath and just crack. Honestly, the noise is just, and that's when I think
like a bolt cutter.
No, honestly, yeah, and you literally just crack through.
You're breaking through some like a D-lock.
Honestly,
that's crazy.
That was nuts. And
is that the point of fainting?
Yeah. And I think
Nausea.
it's just so overwhelming for some people.
Wow.
And I stood there and I was like, damn, we've really arrived.
It took 5 years.
Yeah, but I am here. Yeah, there we go.
We could have done this on day one of on medical school, just so we know whether we want to invest the next 5 years in this.
That was day one
of medical school.
That was day one.
Oh, day one of medical school.
Yeah,
I thought this was your foundation year.
No, that was day one of medical school. That's even
wow.
before. That's day one of 5 years.
Because that could conceivably be like what 18, 19-year-olds, right?
Yeah, exactly. I went at 21, but yeah, you do have 18, 19-year-olds starting at that. And actually, you sometimes it's an experience.
Wow.
And honestly, it just keeps on rolling and rolling from there and stuff. But I don't even know how we segued on that actually. But.
I mean, as dramatic as it sounds, I think if you have an interest in this world, it sounds really quite exciting and something that will definitely you're not going to see every day is not going to be the same.
No, for sure,
right?
For
and
sure.
I'm sure you could probably give us a bit more detail on that. But so I guess thinking about all of the different areas you cover, so you've got your GP practice work, sports medicine, A&E. You've got your teaching students. And at the same time, you're a professional TV watcher.
I am a professional TV watcher.
I don't know where you find the time, but
neither do I.
How did you? How and why? I guess did you kind of cross over some of these different areas, particularly with your interest in sports medicine and you do A&E work? How did you get into it and why?
I think the main thing that I sort of wanted or want from a career is and it sounds weird saying this as doctor, but I don't want to be bored, right? I need the variety to keep me going. I think it's just my personality. So they're all things that you can do in part-time capacity, or they all go quite nicely together. And I think that's essentially what brought me towards those things. I like football. I like sport in general, and so that's why I always wanted to do sort of sports medicine and
fun personal interest aspect.
Yeah, exactly, and also health and fitness and preventative medicine. Rather than let's try and see if we can get to the problem before it happens, sort of thing.
And do you find those kind of patients how do they compare to your general public with regards to treatment, or does it vary?
So obviously the patients in general practice would probably be the same as the patients you get in A&E. It just depends on what they're coming in with. Obviously, some people come in with very acute problems, and they might just go to hospital. So the general practice and A&E are just general public patients, and then the sports medicine are athletes, so they're a lot fitter, and it's just, sort of my role in that is to ensure that if anything happens, there's someone there. Very rarely does anything happen, which is a good thing. Touch wood.
Yeah.
But yeah, generally speaking, that's just that sort of.
I think. Sorry, I'll just very briefly, like with the development of sports medicine in general, like I think it's just incredible, isn't it? Like with the defibrillators being at stadiums, not just football, but across all professional sports. And I think since it's not even really that long ago when who was the footballer? Young black guy,
Fabrice Mwamba.
Was it Mwamba? Yeah, was he the first? Yeah, when he collapsed and had his heart problem, and like the response and stuff. I mean, and since then it's improved. You got Christian Eriksen's and all that kind of thing, but it's so critically important. I think like the awareness of it is so much greater. People think athletes are these specimens, like health specimens, but who knows what's going on the inside? I think that their body's under a lot of stress. How do you find the time?
It's there.
Yeah.
It's there. I'm not going to Molly May. We all have 24 hours.
Yeah. Hey, mate, we may blow up.
No, it's there. It's there. Listen, like, the time is there. I always say that it's interesting. I think being a doctor is a difficult job because I describe it as downloading other people's emotions just back to back to back, because you're seeing so many different people and everyone has everyone's got their own problems and stuff. So I think it's very mentally tiring. But everyone has busy jobs. It doesn't matter what it is. Lawyers, bankers, there are other people in the hospital, like some of the cleaners that I see in the hospital, like, when I'm going there in the morning, they're there before I'm there.
Yeah.
When I'm leaving, they're still there, type of thing. And, we'll be on a run of sort of, 10 days in a row or something. Well, actually 9 days or something. And they'll be there all 9 days with you. So I think, the time is there. It's just about taking each day as it comes and trying to get your rest where you can, and like doing different stuff, like coming and sitting with you guys, sort of breaks up my week. It's good fun for me.
And so like the A&E work that you do, you mentioned, is like as a locum.
Yeah.
So is that on your days off? Is that on like in the evenings when you've done a shift in the GP practice?
Yeah, interesting. Yeah. So I don't know if I could say. It's usually on my days off. And actually sometimes what I do is that when I have some education days, I'll do my education in the morning, and then I'll go and do the sort of locums in the afternoon.
Super interesting.
And any kind of tips or pieces of advice you'd give someone who was maybe thinking about going in, whether they be doing their A-levels or undergoing a degree? Like what key tips would you give them before embarking on a medical degree, or everything that comes with at least applying to get into it?
I think know why you want to do medicine. I think it's I think every few years the profession changes slightly, and it's for every new entry of people, it's different to what the previous entry was like, if that makes sense. For every new generation of doctors, it's different.
Can you give us an example of a difference that people may encounter?
Okay, so some of the things that obviously, and this is passed on to me. So some of the things that some of the older doctors have said to us was that when they were where I am now and when they were training, there was a lot more variety. They had a lot more control over what they did, which meant that they were able to get different experiences. For my generation, it's a lot more regimented, and it's a lot more regimented. We don't really have a lot of control over where you go. So we sort of apply to jobs, and you either get the job in the place that you want, or you get the job in a place that you don't want. You then have to make a decision as to whether you want to move, which I suppose everybody does in every different job. But it's just, you want to be a cardiologist. You don't get a training number in London and then training numbers are in Manchester, Leeds, Oxford, you have to make a decision as to where you want to go. Whereas I'm not sure it was quite like that for the generation before us. So I think for the new guys, you have to be aware that you're going to move around. You have to be resilient because the job is hard. I think generally as a society or generation, I think people are a lot more in tune with how they feel and are probably less inclined or don't want to be uncomfortable for no reason. I think I can see the doctors that are above us and the doctors that are below us, and they're just like so unbelievably different. The older doctors say that we're soft, and we think that some of the younger doctors are soft, and everyone just thinks everyone's soft. So I think you have to have a bit of resilience. You have to know what you want to do. I think don't rush through medicine. Back in the day, being a consultant was everything. I think now life is a bit different. Take your time through it. Take the breaks that you need. Explore specialties.
And on the resilience piece, you mentioned that being a doctor can be described as downloading other people's emotions.
That's my own personal.
Yeah, it's a great take. It's a really good way of putting it.
With that, do you have any kind of coping mechanisms? You mentioned kind of trying to break up your week from a time management perspective, but I can only imagine I have it sometimes with if a friend's going through something bad and you're kind of there with them, you can kind of take it on. So if you're dealing with people in sometimes their worst moments, back to back, how do you then kind of almost switch that off when you go home, or how do you at least deal with it in a healthy way?
Yeah, for me, I try not to talk about work outside of work.
Sorry,
yeah. No. Apart from this, as I was thinking about what I was going to say, I thought that was going to come out. No, it's fine. No. But I try. It's very easy, especially because my girlfriend's a doctor as well. So it's very easy to get home and offload, and she'll get it because we're both doctors. But what I have really worked on over the years is that when I step out of the hospital, the GP practice, I'm just going to leave it there. Sometimes you can't do that every day because some things are just overwhelming to the point that you just need to offload it and then you're done. But generally my rule is that I just don't talk about it when I'm not there.
And slightly separate point, but what you said reminded me of something that a lady, one of my mentors, said to me the other day about the habits of highly successful people, and it's something called transition rituals. Okay. You often find that they have. So before going into a meeting, you have your own little thing you do to kind of get yourself into the mindset of I'm going to this meeting. Before you go home, how do you switch from AJ the doctor to AJ the partner? And she said that I should maybe think about doing that given all the different modes I'm in on a given day. So yeah, just one to think about. I know I'm trying with that, and I found it to be quite helpful, but yeah, it could be something that's useful to the listeners too.
Yeah, definitely. And music helps. I don't know, but when I leave my headphones or my AirPods, whatever, go in and then bang, then you feel like a different person almost, yeah. And I always change my clothes as well.
That's a good one, yeah. Step into a different role. Does health, you mentioned health and fitness, does that exercise play a role in clearing your mind?
Yeah. I try to get to the gym when I can, not professional weightlifter or anything like that, but just, get your body going. Again, it's something else that will take your mind off work for, 45 minutes to an hour, variety.
And funnily enough, it actually lifts your energy as well, right? When you feel flat, doing that will help you. I'm just curious. I spoke to some psychologists and counsellors in the past when I was kind of considering that career. They mentioned that because they deal with a lot of emotion from people, and as you say, Alex, sort of people in some of their worst points really, or lowest points, and they have a kind of a mentor buddy that they can discuss as well, because some things could be really heavy. Do you have a sort of similar support network within your industry?
We're supposed to.
Yeah. Okay.
Or is it just Sarah?
Yeah, do you know what? This is interesting bringing this up. I think this is probably one of the things that I think really lets the profession down as a whole, is that people do feel extremely unsupported at work.
Okay.
There are various reasons for that. I think everyone's got their own stress. I think, we're all supposed to have clinical supervisors, education supervisors and things, but I think a lot of people just don't feel that they're supported.
Lip services.
Yeah,
almost, yeah. Exactly.
I mean, I think I'm just quite lucky, but, you know, I've had good supervisors, and the supervisor that I've got now is like amazing. So, you know, I'm quite happy with that. But I think, yeah, I would definitely say that is one big downside of medicine. And, you know, to sort of combine that with the question that you asked before, it's that important for people to start to think about coping mechanisms before you have to cope.
Yeah.
That's very weird. I suppose it's difficult for people to think, but you've almost got to think, right, if this happens, you know, how can I bring myself down off that emotion, or what do I do for fun, and how do I maintain that fun? Because that's one of the things that I regret a bit about sort of medical school and maybe like my early foundation years, was that I kind of stopped doing some of the things that I like doing just because it was just a bit overwhelming. But yeah, definitely you know, just keep your hobbies, keep your interests, keep up with your friends. It's hard, but it's worth it, because once you get through that initial period, you still then got everything there, rather than having to sort of build it all back up again. So
that's a really interesting one, and I think probably quite unique to, say, medicine, or say being a vet, where you're dealing with scenarios which most don't, nurses as well, kind of getting those coping mechanisms in place preemptively. I think,
for sure.
Yeah, I hadn't really thought about too much.
Yeah.
I guess you don't have to think about in other industries, or I certainly haven't had to in my career. So again, another one for the listeners to reflect on.
And it's such a unique profession that it's not really like anything else, because you can be in any kind of corporate role, or, you know, like a skills-based career where you just don't see or hear anything like you would hear on a day-to-day basis, or a doctor would. And with that, you mentioned resilience, and I would imagine that is a skill or a characteristic that you probably need to have within you from quite an early stage of your life. And then can you kind of break down maybe some of the skills that are more sort of in that department that you kind of need to have more naturally, and then some skills that you have had to develop over time that someone aspiring to be a doctor needs to think about working on?
Interesting question, because a lot of the medical school curriculums have building resilience into the curriculum. I think there's a thinking that, you know, you can get people to be more resilient, which I think you can. And I think the way that you do that is getting them to think, as I said, about worst case scenarios, or how would I deal with this, or what happens if this happens. And you have to do a lot of the work yourself, but at least someone is helping you think about it. So resilience is one, I'd say. Being organized, I think, helps. I think that helps in any job. And I don't mean being organized at work. I mean just being organized in your life generally. The worst thing that I think, especially, and I keep on going back to those foundation years, because I think that's where people struggle to cope the most, is just feeling like your life is just work. I would honestly really say, and I'm a bit pedantic, but I think I'd honestly really say, look at, when you get your rota or whatever, look at your calendar, look at your week, and say, right, where am I going to rest, and where am I going to go and see my friends, or, you know, where am I going to go and watch film, or you know, whatever it is that you like doing. So be organized in your life outside of work. Be resilient. Think about your coping mechanisms early. It's a difficult one, because a lot of it can be sort of dominated by your shifts, but try and get a good sleeping pattern.
Right, okay.
That is a very say as I do. What's that phrase?
Say as I do, do as I say.
Yeah. Because my sleeping pattern is outrageous. It's just terrible. But when I do sleep well, I can feel the difference. So definitely, I think, you know, sort of working on your sleep early, and sort of skills to build up. Again, emotional intelligence is another one, but that's a very that's controversial, because I think you have to. You learn some things that you should say, or rather things that you shouldn't say, in response to what people tell you. And sometimes the only way to learn that is put your foot in it.
Any examples?
Personally, I don't have any. But,
any anecdotes then?
I mean, so I'll put it this way. So, for example, when we're teaching the medical students how to consult with people, we always tell them to be very careful how they respond, because natural response are things like someone's talking to you, okay, that's good, okay, that's
Cool.
all right, cool,
Yeah.
all that type of
Yeah,
stuff.
yeah.
Someone might tell you the most horrific thing, and your response will just be like, cool. And obviously it's not cool, and it's not
cool
okay, and stuff like that. So you just have to be quite careful on how you respond to people.
So a small anecdote which might be slightly related to that. I got my hair cut last week. Probably couldn't tell because it's a mess now, but
Yeah, you look good, don't worry.
my barber and I were just having a chat, top guy, and I mentioned the concept I came across, Carl Jung quote about the fact that people don't hold or have thoughts have or hold people.
Okay.
Can spin you out a bit because the more you think about it, the more it feels true. But he said, that I've heard that one before, and it reminds me of a proverb, which is, you need to be quick to listen and slow to speak.
Yeah.
And he said, I really loved that proverb, and I kept mulling over it. And one day it became apparent to me that it's not just quick to listen to others, it's quick to listen to the thoughts that come to the surface of your own mind and slow to speak them. And it sounds like that's probably
that's very, very
something
adept.
You should think about if you're
100%.
dealing with patients, right?
100%.
The thoughts that come to mind aren't necessarily the ones you should be vocalizing immediately.
Yeah. But building that communication skill is, I imagine, is so key in what you guys do, because like you say, even using very like innate or just colloquial words, filler words that don't really mean anything. You don't even mean them. You're just filling a
you
gap.
Just say it. Yeah,
can be taken out of context.
Some people never learn how to do it, and they just get through their careers.
Yeah,
and work on your facial expressions, which I'm still trying to do. But face masks, they saved they saved my life.
Lifesavers in a number of forms.
I just say everyone who knows me can always, my face. Someone says something like, well, I've got a face mask here. They can't see.
Just keep the eyes still.
Yeah, exactly. That my jaw is just on the floor.
Wow. But I think this kind of segues into that question of delivering bad news, and you must have to do this on relatively regular occasion compared to us or anyone else, really.
Yeah.
How do you process that? It's something that obviously, you're talking about emotional intelligence. It must trigger you as well, but you have to disconnect from the person, from the thing. And how does that kind of work and look for you?
So you're taught a bit how to deliver bad news in medical school. The modules in most universities would be called like breaking bad news. And there are definitely some formulas in which you go through. I can't remember them specifically now. You just do them, but I think it's something like I think we used to call it spikes or something, where you sort of you set the scene, you prepare the person, you sort of lead in with things, and then you deliver it, and then follow it up with a plan. One of the things that one of the consultants taught me really early was that don't go to someone with bad news if there isn't a plan. And that doesn't have to be a definitive plan to say this is definitely what we're going to do, but it is right. This is the bad news, and now this is the next step. And the next step may just be, you're going to go and talk to a specialist, or we're going to take some more blood tests, or we need to, organize an operation, or, sometimes it's just here's a room and you can sit and you can process. But the worst thing that you can do when you deliver bad news to people, especially in hospital settings, is just to then leave them on their own, to not feel like there's no next step. And sometimes it's hard. I think, again, as you get more experienced, it takes less sort of skin off your back. But I remember when I, first started as a doctor, having to tell people some horrible things, and you sometimes feel emotional, and naturally, as people, you feel more attached to some people as others, than others. So it can always be a little bit more sad when you have to deliver bad news to, someone that you've liked for whatever reason.
Does it desensitize you?
I think for most people, yeah. I have to say for most people, yeah. I think for me, definitely. I don't think I was ever like the most emotional, soft person anyway. I say soft as like just an easy term, but I definitely think I'm a lot more kind of like
clinical.
Yeah. And it's not that I don't empathize with people, but it's just like, and if I'm being really honest, you can't feel everything for everyone all of the time. It's just not possible. But yeah, so that's my...
Interesting.
I guess it would kind of interfere with how effectively you could do your job.
Exactly.
For all of your patients.
That's probably why you shouldn't. Well, not probably why, but I would say that's part of the reason why you're not really supposed to treat your family members and stuff. I think it just clouds your judgment completely. So.
I don't know if you had any other questions about career.
No, that's really insightful, and I think offers a lot of great information for our listeners who are thinking about going into medicine, whether they're 18 and starting their academic journey in further education, or they're more mature and want to career change. I think it's a great bit of information to know that if you've already done an undergrad, look into the schemes where you can potentially reduce the amount of time or number of years that you'd have to study. You may just have to sit a really quite a difficult exam.
I think it's hard. Some people may think it's easy, but I think
but definitely look into it. So that's a great bit of insight. Do you want to move us on to the next segment?
Absolutely. So just moving on to a bit about you, your background. So if you wouldn't mind just briefly describing as best you can, like your parents' background and your socioeconomic background, to give the viewers a bit of an insight into who you were before becoming Dr. AJ, which I must apologise.
The man and the legend.
That's it. Yeah.
I got that wrong. I should have said Dr. AJ.
Nah, you're good.
That's it. I realised. Didn't do
that's what my mum calls me sometimes.
Well, the man, the myth, the legend.
I bet there's like intense pride in her calling you Dr.
Absolutely.
AJ.
She loves it. My dad loves it more. He loves it.
Just to frame what Alex has said as well is, the purpose of this is really to give our listeners like inspiration that you can come from different cultural backgrounds, ethnicities, socioeconomic backgrounds, and you can still forge a career or a path in whatever it is that you feel is for you. And so that we just want to kind of take a brief dive into our guests' background
for sure,
and see where they're from and how they came up, you know?
Yeah. So obviously both my parents are Nigerian. So I'm Nigerian. I was born in Nigeria. I think I moved to England when I was about 4 or 5.
Okay.
Was living in sort of like northwest London. And then I went to and then obviously primary school, and then I went to a secondary school, which was a boarding school called Christ Hospital. It's quite an interesting boarding school because the easiest way to put it is that it's like a means-tested boarding school, which essentially, if your parents don't earn anything, you don't pay anything. There's like they have like central governors and things that, scholarships and money and fund it through that. And, people have had different experiences in the school, but I think for me it was good. I really enjoyed school. It gave me lots of opportunities. I didn't take half as many as I should have done. But actually, it was good. Exposed me to lots of things.
Was it, I always find like people going to boarding school quite interesting. Was it something that your parents thought would be like a great learning experience and development for you, kind of being on your own, sort of learning from other people, just like in that enclosed environment? Or was it like, well, where we live is maybe there's, well, you have some of that, but some parents travel a lot, or they just think the area we're in is just not a great catchment, and so we want to give them the best opportunity.
I think it's a combination of all those things, but I think I definitely remember my mum saying that she wanted us to just have as many experiences as possible, and it was easier if we were in a place where the experiences were. And the interesting thing about school was
such an interesting perspective.
I think that was. I never really thought twice about it. I was like, whatever. I was like 10 or 11. I was like, yeah, cool. Massive sleepovers. But and the interesting thing about school was that it's a boarding school, so it's a private school, but it wasn't like a school where everyone was like super wealthy. I think at the time when I was in school, only about 7% or even less than that probably of the pupils paid full school fees. So we had like a breadth of variety of people.
But it was kind of academically tested to get in?
You had to do an exam to get in, and actually the exam got harder in the years below me, but I did one exam to get in. As an example, my brother came the year after me. He had to do 2 exams to get in because it became quite popular. But I think it gave good life experience. As I said, some people, it wasn't for everyone, and some people really struggled, but I think I had quite a good time there. And
I'm asking from my own like personal interest, any kind of like key principles you learned growing up in that environment?
I think about this all the time. I don't know. I have different opinion in it all of the time. I think the resilience that I think I have, I think came from that. I think going to boarding school is hard. You know, there are times that you want to leave. If you go to a day school, right, something happens to you 3:30, you can go home. At 3:30, we were getting ready to go to another 2 lessons. And then if something happens to you in the evening, right, you can't go home. You then got to go and face everyone at 7 and stuff. So I think it was just
like dinners
and roll calls and your sort of homework time and stuff. So I think it was really a place that I learned how to, for me anyway, was how to deal with something like quite quickly. You didn't deal with it in the best way all of the time, but you had to get over it in your mind like super quickly, because if you let it eat you up. So I think that's one thing. So resilience, learning myself about how I cope with stuff. I think I learned definitely the importance of like friends at school, and because you need people to get you through that. And, you know, some of them are sort of like my de facto family pretty much, because, you know, we, you know, made friends at 11 and, you know, 19 years later, 20 years later, you're still, you know, friends with the same people. And that sort of like sense of community and culture and learning from other people and, you know, seeing your friends grow. And conversely as well, you know, you move away from other people and you have to appreciate and understand and learn that that is a normal part of life. Doesn't mean you're a bad person, doesn't mean they're a bad person. It's just like, you know, everyone is in your life for a reason at a time.
And were there any kind of key personal influences in terms of you going into medicine? Like, at what point did you decide, or was it just something you've always wanted to do?
I think it's just something I've always wanted to do. I cannot think of a time when I was like, yeah, this is what I wanted to do medicine. I can think of times when I didn't want to do medicine.
Day one.
Day one.
Yeah.
And everyone wanted to be David Beckham at one point. Yeah.
But so this is my question. You mentioned earlier on that for people considering going into medicine, think about your why.
Yeah.
What was your why?
So that's you know when I said do as I say.
Okay.
I actually honestly,
it was just a natural.
I'm just being honest. I actually really don't know. I always said it. I'd always said I'm going to be a doctor. I'm going to be a doctor. And honestly, that is the one thing that kept me going through sort of the first degree in medical school, even when I've felt like I wanted to not be a doctor after I've actually started being a doctor. It's just that, you know, I wanted to do it and, you know, I've done it.
You did it.
Yeah. So
Nice.
I think there's going to be a natural point at somewhere where I think, right, do I, you know, want to keep on going or do I want to do something else? But I think it was just like a personal pride thing. Yeah, I don't know. Just like, yeah, here we go. Did it.
Nice. Nikki, I don't know if you had any more questions about AJ's background, Dr. AJ's background.
Dr. AJ's. No, I think you summarised it quite well and gave us an insight into how it looked. And I, to be honest, you gave quite an interesting insight into going to a boarding school. Which, you know, really piques my interest. And I've never really heard it put that way. Be where the experiences are.
And that's what it was
really
like.
Great outlook. So yeah, definitely some food for thought there. So thank you for sharing that. And yeah, how about you, Alex?
No more questions on that. I don't know if you want to wrap up.
Yeah, brilliant. So before we wrap up, we like to ask our guests a couple of questions.
Go on.
Food for thought.
I'm scared. Go on.
Yeah. Alex, do you want to take it away with the first one?
Yeah, of course. So first one is, in fact, I'm going to switch it up a little bit because I'm
even more scared.
interested in knowing, who you'd identify. But 3 dinner guests from any time in history and why?
From any time in history. Okay, now I have to think about the 3 things that I like.
Football's got to be on.
Yeah. Football is on there, but football-wise. See, the obvious answer would be I support United, so Alex Ferguson.
Come on.
But, I don't know. They're probably quite. Okay, I'll tell you who I'd have. I'd have Muhammad Ali.
Nice.
I think he was in a very interesting period of life, and you know, sort of switched his name, and he was, you know, Vietnam War and all that sort of stuff. So I think that'd be quite interesting. So I'd go Muhammad Ali. Who else would I go? Maybe Malcolm X. Just because I think growing up, and again, I don't know if this is controversial to say, but growing up, you sort of, sort of taught or learned somehow it was sort of like Martin Luther King on one side and Malcolm X on the other side. But actually, when you get older and you realise that not everything is sort of as black and white, you know, that gives you you know, that's quite interesting to think about. And then third guest, I actually read a book recently by Maya Angelou called I Know Why Cage Bird Sings. It'd be quite interesting just to sit and talk to her and see her experiences of life and stuff. So maybe I'd have those three as my first dinner. I'd have to have like 3 or 4 because there's so many people, but let's go with this.
Great pick.
Yeah. The all-time, you know, kind of parameter is quite wide. It's pretty tough to choose. But no,
they're good choices. Yeah, probably better than I would pick.
Yeah, no, it's really awesome. Yeah. And well, you may have mentioned it, but the any podcasts or books that you might recommend for our listeners to kind of help them with their life journey or career?
I don't know if it. I don't know if it would directly help, but you have to think about it. I read a book by a poet called Lemn Sissay, and the book is called My Name Is Why, and it's essentially he chronicles his life in the British care system. So he was young. His mum was from Ethiopia. She was young. She had him young and he was taken away from her, and then he went through the British care system and had an absolutely horrific time. It's pretty much like a story of like cruelty. And he sort of got out of it the other side and tells the story in such like a powerful, thought-provoking way. And I think it's just an interesting book for everyone to read. Just have an appreciation of how difficult life can be for some people, because we don't always see it and we don't really realize it. But I think when it's put down in words, and you know, the book's really interesting because it has the letters that they wrote about him at the time photocopied into the book.
Oh wow!
Yeah, and I think it just gives you a proper perspective of how difficult the care system can be for people. And you know, being someone in healthcare, I think that's always important to be aware of how difficult life is for some people, and then how he sort of got through it and was successful against like another, you know, power of hope, and that you can make it and courage. And
sounds like the perfect book for our listeners.
Lemn Sissay, My Name Is Why. It's a great book. It's honestly
awesome. We'll put that in the show notes.
It's really good.
Alex, any closing words?
Very quick one from me. This weekend, my fiance messaged me something, a concept about resilience and our relationships with ourselves, and she basically came across a concept which said that our rational brain is the rider, whereas our emotions are the horse. And the two need to work in harmony. And I think what you've been talking about today, like, brought that to mind in terms of the resilience piece and even thinking before you speak. And yeah, just one for our listeners to perhaps think about, like our emotions often are powerful and drive us in particular directions, but we need to make sure we're managing where they take us to ensure that we don't end up going further and faster down darker paths, which aren't necessarily what's best for us. And when you spoke about your emotional management and your coping mechanisms, it brought that to mind. So,
yeah.
Fun closing thoughts
Brilliant.
from me.
I love that.
I like that.
Great.
I like that.
AJ, thank you so much for joining us. It's been a pleasure. I've really enjoyed it. I'm sure Alex has too. Guys, thank you for listening. As always, please subscribe, comment, like. Most importantly, listen. Continue leveling up. Right? We got your back. We believe in you. Thanks for listening. Until the next one. Peace out.
Thanks, guys.
Cheers, guys. Thank you very much.